The Kenya Prison Service has grown gradually since its inception on March 18, 1911. By then, the Prisons Department was set as part of the police under the Inspector General of Police. The Prisons Board was responsible for management of prisons. The post of Commissioner of Prisons was created way back in 1917, and this has remained so ever since. Kenya Prison Services plays an important role in the country by keeping offenders in safe custody. The service provides opportunities for rehabilitation, correcting, deterrence of would-be offenders, and protecting society. The core functions of the prison service are containing in safe custody and subsequent rehabilitation of all categories of prisoners so that they be reintegrated into the society as responsible citizens who can contribute positively to the economic development of the country. Kenya has over 100 prison facilities to accommodate the increasing number of offenders. In fact, the admission rate still surpasses the available facilities, leading to serious overcrowding in the prisons. Kenya's prisons were built to handle 16,000 prisoners, but at the present they have a population of over 48,000 inmates, this obviously leading to congestion. Since prisons were established in Kenya, the orientation at the time and years that preceded was largely tilted towards punishing criminals. But from the 1980s, there was a shift in focus towards rehabilitation and reforming of offenders through training. This was aimed at changing the offender's behavior through education and training so that on reintegration into the free society, they would make meaningful contribution. The phase of reforms put more emphasis on counseling and rehabilitation of prisoners in a humane and disciplined way. Indeed, the vision of the prison service is to be a correctional service of excellence in Africa and beyond. The government, way back in 2001, started the process of penal reforms in Kenya Prison Service. First, it was setting up of necessary administrative and infrastructural adjustments in line with international standards. 2, calling on leadership to embrace good practices in the management of penal institutions. And 3, collaboration with various actors in the criminal justice system, such as the civil society organizations, media, and faith-based organizations. Due to the changing situation, Kenya Prison Service initiated the reform agenda. These reforms included open-door policy for the stakeholders and the entire society to know what happens in prisons, remote parenting, which encourages inmates to take an active role not only by staying in touch with their families, but through retaining their roles as parents. Relatives of prisoners are free to visit them in prison. There are many more reforms which have been undertaken by the Kenya Prison Service. But among all these inmates, there are those inmates who are referred to as special needs offenders. Who are these special needs offenders?
These are people who are in prison. They are detained. They don't have much freedom like those who are in the normal society. We have the elderly people who are in prison. We have juveniles. We also have the sick, expectant mothers. We have mothers with children, people with disabilities, and of course we have the mentally ill in our institutions. Those are the people who are with us and we put them under that list of people with special needs, offenders with special needs.
In the context of criminal justice administration, a special need offender falls under the following category: sex offenders, offenders with HIV/AIDS, mentally ill offenders, substance abusers, mothers accompanied by their children in prison, expectant women, physically challenged, abused offenders, refugees, transsexual offenders, child offenders, and vulnerable children in the justice system.
The freedom of a child out there playing as a kid, having fun with family, relatives. These are challenges, you know. You've got to really be keen on what you tell your child, where they are. The fact that the kid is growing and not bonding with the father, the male figure is, not there to offer their roles. And then again, the behavior that they catch up on while locked up in prison, Some of the words you'll hear these kids using, it's really demeaning to these children.
Having a small kid in such a place sometimes can be very hard, especially when there are other kids suffering TB, chronic diseases. Though they are given medication, but sometimes it's really stressful for the mothers. And food, they eat the same food day in, day out. Sometimes they do want, because they're just fed up with the same diet every now and again, to improve facilities and to make the environment conducive for the children, because these are not prisoners. We are, but they found themselves in situations that are unavoidable. The medication is okay. When they fall sick, they're taken to Kenyatta, they're given good attention.
The rest segment of this program will be dedicated to special needs offenders. The prison service has gone ahead in making lives for special needs offenders comfortable in prison under the prison's reforms agenda. Lang'ata Women Prison, Kamiti, and Naivasha prisons have designated separate accommodation for mental patients. Maternity wards for mothers and babies have been established in Lang'ata. There is HIV testing in 65 prisons, care and treatment in 32 prisons in the country. Youth offenders are now being taken care of in Bostal institutions, and plans are underway to construct a Bostal institution for girls. Counseling rooms have been designated in all probation offices and prisons.
Prisoners and offenders in general are not a homogeneous category of our population. That offenders are people with different challenges, different expectations, different backgrounds, and therefore they have to be treated each in a special way so that the rehabilitation programs become a success.
The 2011 International Conference on Special Needs Offenders will be hosted by Kenya in October. The theme of the conference is Special Needs of Offenders, an Area of Global Concern and Collaborative Responsibility.
Sometimes they ask you, where are we here? When they see like these Afandis, where is our Baba?
Cater for expectant mothers, for special diet, for special room for them. And if possible, the expectant mothers who are ordinary offense, they can be released or given put under probation, so that they can deliver in their home.
On the realization that this particular group needs to be reintegrated with the families. As we realize, the Kenyan culture is such that most of us would like to run away from these vulnerable or special needs offenders. And therefore, there's need for us to involve the communities, to involve the family members, and to involve the entire society. We need an integrated approach with the key stakeholders, and I believe during this conference, this will assist us quite a lot.
The juveniles, we have the postal institutions. We have separated them from the adult offenders. And they have separate treatment. We have officers who are trained to handle them. Then their programs learn according to their age brackets. We have separated them completely. For their, like the sick, we give them total attention. We have a department. We run a department of health care in the prisons. And they are checked from time to time. We have clinics, we have dispensaries. We are even now moving to our districts. We have sought assistance from the Ministry of Health to upgrade our dispensaries, to be hospitals, so that we can be able to admit and then offer better services.
The objectives of the conference are to share knowledge and good practice, treatment programs and services on persons with special needs in contact with the criminal justice system, to inform on innovative training programs, research and education for offenders with special needs, while taking cognizance of cultural differences, sensitivities, and shared needs. To develop rehabilitation and reintegration programs for special needs offenders that involves the community and to ensure community safety.
For petty offenders especially, they should not be in prison, locked up with their children. I'm sure there are ways by which they can, attend to their sentence while they're out there, maybe on probation, other rehabilitational ways other than locking the mother and their kid in prison.
Came in when I was 6 months pregnant. I delivered in prison, and so far so good.